Hello friends, today let's talk about the topic sprain, strain, contusion and hematoma, the dislocation and fracture. So let's start with the introduction of today's class. The injury is an increasingly significant health problem throughout the world. The physical trauma is a physical injury that is serious and could endanger a patient life. The common causes of physical trauma includes sport injuries, car accident, burns, drowning, explosion, crush injuries, and severe beating. There are a number of concerns with physical trauma. The immediate problem can include sprain, strain, contusion, fracture, dislocation, blood loss, brain damage, respiratory impairment, and severe pain. The patient must be quickly assessed to identify their injuries and to determine which injuries are most serious. So first comes the sprain. So let's talk about the definition of sprain. A sprain, also known as a torn ligament, is damage to one or more ligaments in a joint, often caused by trauma or a joint being taken beyond its functional range of motion. The severity of sprain ranges from a minor injury which resolves in a few days to a major rupture of one or more ligaments requiring surgical fixation and a period of immobilization. Sprains can occur in any joint but are most common in the ankle and wrists. So here comes the signs and symptoms of sprain. We have pain, swelling, bruising, decreased ability to move the limb. If a ligament ruptured, one may hear a popping sound, difficulty using the affected extremities. Causes of sprain. Sprains typically occur when the joint is taken beyond its functional range of motion. There are certain factors which increase the risk of sprains. Fatigue of muscles generally leads to sprain. When one suddenly starts to exercise after a sedentary lifestyle, sprains are quite common. The warming up is thought to loosen the joint, increase blood flow, and makes the joint more flexible. So here comes the classification of sprain. First one, first degree sprain. The fibers of the ligaments are stretched but intact. Second one, the second degree sprain is a tear or part of a ligament from a third to almost all its fibers. Third one, third degree sprain is a complete rupture of the ligament, sometimes avulsing a piece of bone. So here comes the treatment of sprain. The first modality for sprain can be remembered using the acronym RISE. R for raise, I for icing, C for compression, and E for elevation. The treatment of sprain depends on the extent of injury and the joint involved. The medication like non-steroidal anti-inflammatory drugs can relieve pain. The topical NSAIDs appears to be as good as those taken by mouth. So here comes the raise. The sprain should be rested. No additional force should be applied on side of the sprain. The second one is ice. Ice should be applied immediately to the sprain to reduce swelling and pain. It can be applied for 10 to 15 minutes at a time of 3 to 4 times a day. Ice can be combined with the wrapping to minimize swelling and provide support. The third is the compression. The dressing, bandage or ice wraps should be used to immobilize the sprain and provide supports. When wrapping the injury, more pressure should be applied at the far end of the injury and decrease in the direction of the heart. The reason for this is that it causes unnecessary fluid to be flushed back up more easily bloodstream in order to recycle. The compression should not cut off the circulation of the limb. The fourth one is elevation. The sprain joint should be kept elevated in relation to the rest of the body, will also help minimize swelling. So here comes the next topic, strain. So first of all, the definition of strain. A strain is when a muscle is stretched too much and tears. It is also called a pull muscle. A strain is a painful injury. It can be caused by an accident, overuse a muscle, or using a muscle in the wrong way. So here comes the causes of strain. A strain may be caused by too much physical activities or effort, improperly warming up before the physical activities, poor flexibility. So here comes the symptoms of strain. Pain and difficulty in moving the injured muscle, discolored and bruised skin, and third one is swelling. So here comes the treatment of sprain. First one, apply ice right away to reduce swelling. Wrap the ice in cloths. Do not place ice directly on the skin. Apply ice for 10 to 15 minutes every 1 hour for the first day and every 3 to 4 hours after that. Second one, use ice for the first 3 days. After 3 days, either heat or ice may be helpful if person still have pain. Third one, rest the pull muscle for at least a day. If possible, keep the pull muscle raised above heart. Fourth one, try not to use a strained muscle which is still painful. When the pain starts to go away, increase activity by gently stretching the injured muscle. So here comes the contusion. A bruise or contusion is caused when blood vessels are damaged or broken as a result of a blow to the skin. The raised area of a bump or bruises result from blood leaking from the injured blood vessels into the tissue as well as from the body's response to an injury. A contusion may be painful to touch because the blood that has pulled under the skin is putting pressure on nearby nerve endings. So here comes the symptoms of contusion. A contusion changes in appearance over time and may be sensitive or tender to touch. A contusion is usually reddish in color, reflecting the color of the blood through the skin. Over time, the contusion will develop a blue or purple skin to it. Finally, the contusion will turn a greenish blue and then a yellow or brown color. The body can heal a contusion within 2 to 3 weeks after the injury occurred. The next topic is haematoma. A haematoma is an abnormal collection of blood outside of a blood vessels. It occurs because the wall of a blood vessel's wall, artery, veins or capillaries has been damaged as blood has been leaked out into the tissue where it does not belong. The haematoma may be tiny with just a dot of blood, or it can be large and cause significant swelling. So here comes the signs and symptoms of haematoma. Some haematomas are visible under the surface of the skin, commonly called bruises, or possibly felt as masses or lump. Lumps may be caused by the limitation of the blood to a sac, subcutaneous or intramuscular tissue space isolated by a fascial glands. This is a key anatomical feature that helps prevent injury from causing massive blood loss. In most cases, the haematoma such as a sac of blood eventually dissolve. However, in some cases, they may continue to grow such as due to blood seepage or so no changes. If the sac of blood does not disappear, then it may need to be surgically cleaned out or repaired. So here comes the types of hematoma. The subdermal hematoma under the skin. Second one, skull or brain. Epidural hematoma between the skull and dura mater. Subdural hematoma between the dura mater and acronoid mater. Subarachnoid hematoma between the acronoid mater and pia mater. Haematoma between the skin and the layer of the cartilage of the ear. Breast hematoma, that is in the breast. Perichondral hematoma, that is in the ear. Perineal hematoma, that is in the anus. Subungual hematoma, that is in the nail. So here comes the treatment of hematoma. The treatment of hematoma depends upon which organ or body tissue is affected. The superficial hematoma of the skin and soft tissue, such as muscles, may be treated with raise, ice, compression and elevation, that is RICE treatment. So here comes the next topic, the dislocation. A dislocation occurs when the bones in a joint separates. The dislocations can only occur to joints. The dislocation can sustain in any joint of the body, but the more common sites of dislocation includes the shoulder, hip, patella, ankle and finger. So here comes the causes of dislocation. The dislocation typically results when a joint experiences an unexpected or unbalanced impact. This might happen if we fall or experience a harsh hit to the affected area. Signs and symptoms of dislocation. The area may be swollen or look bruised. The area is red or discolored. It may also have a strange shape or be deformed as a result of the dislocation. Some of the other symptoms associated with dislocated joint includes loss of motion, pain during movement, numbness around the area, and tingling feeling. So here comes the treatment of dislocation. First, manipulation or repositioning. Second, immobilization. Third one, medication. Fourth one, surgery. And last one, rehabilitation. So first comes the manipulation. In these methods, physician will manipulate or reposition the joint back into place with under a sedative or anesthetic to remain comfortable and also to allow the muscles near joint to relax, which is the procedure. The second one, immobilization. After joint returns to its proper place, a sling, splint or cast is wear for several weeks. This will prevent the joint from moving and allowing the area to fully heal. The length of time joint needs to be immobilized will vary depending on the joints and severity of the joints. Third one, medication. Most of the pain should go away after the joint returns to its proper place. However, a pain reliever or a muscle relaxant is prescribed if patient still feeling pain. Fourth one, surgery. Surgery is needed only if the dislocation damages nerves or blood vessels or if non-operative method fails. Last one, rehabilitation. The rehabilitation begins after properly repositioning or manipulating the joint into the correct position and removes the sling or splint. The goal of rehabilitation is to gradually increase the joint strength and restore its range of motion. Remember, it is important to go slowly so not to re-injure before the recovery is complete. So here comes the fracture. First, talk about the definition of fractures. A fracture is a complete or incomplete breaks in a bone resulting from the application of excessive forces. So next one is types of bone fracture. Avulsion fracture. A muscle or ligament pulls or the bone fracturing it. The comminuted fracture. The bone is shattered into many pieces. Third one, the compression or crush fracture. This occurs in the spongy bones in the spine. For example, the front portion of the vertebra in the spine may collapse due to osteoporosis. Fracture dislocation. A joint becomes dislocated and one of the bones of the joint has been fractured. The Greenstreak fracture. The bones partly fracture on one side but does not break completely because the rest of the bones can bend. More common among children whose bones are softer and more elastic. Hairline fracture. A partial fracture of the bones. Often this type of fracture is harder to detect. The longitudinal fracture. The break is along the length of the bone. Oblique fracture. A fracture that is diagonal to bone long axis. The pathological fracture. When an underlying disease or condition has already weakened the bones resulting in a fracture, that is bone fracture caused by underlying disease or condition that weakens the bones. Here comes the symptoms of bone fracture. Pain, swelling, bruising, the discolored skin around the affected area, the angulation. The affected area may be bent at an unusual angle. The patient is unable to put weight on the injured area. The patient cannot move the affected area. The affected bones or joints may have a grinding sensation. If it is an open fracture, there may be bleeding. So here comes the treatment of bone fracture. Bone healing is a natural process which in most cases will occur automatically. Fracture treatment is usually aimed at making sure there is the best possible function of the injured part after healing. The treatment also focuses on providing the injured bones with the best circumstances for optimum healing, that is immobilization. So here comes immobilization. As soon as the bones are aligned, they must stay aligned while they heal. This may include plaster casts or plastic functional braces. This holds the bone in position until it has healed. Second one, the metal plates and screws. The procedure uses minimally invasive techniques. The intramedullary nails. The internal steel rods are placed down the center of long bones. Flexible wires may be used in children. The last one is the external fixators. This may be made of metal or carbon fibers. They have steel pins that go into the bones directly through the skin. They are a type of scaffolding outside the body. So here comes the conclusion of today's topic. The traumatic injury may affect many parts of the body, including the brain, the extremities, and internal organs. The severity of injuries can range from minor to life-threatening. Trauma obviously affects the patient physically, but it can have lasting effects on the patient and those close to the patient emotionally. Therefore, it is good to be able to receive prompt and thorough care after suffering any types of severe and life-threatening injuries.